Welcome to another program in our series, Free Thinking Forum. It's my delight today to welcome two senior outreach specialists with the Metropolitan Area Association on Aging. Not for aging, but on aging, right? Emily Justman.
Nice to meet you.
Good to have you with us. And Emily and Marilyn Theesfeld.
That's right.
Thank you. Now, you're a specialist, Marilyn, in the Medicare part of things.
We're both specialists in the big picture, but yeah, that's a focus tonight for me.
And so, well, how did each of you get involved in the field of aging?
Well, for me, it was as simple as I really, really loved my grandparents, and I loved spending time with them. I loved their conversations with me and engaging with me and their stories that they would share. And so because of them, I just found the company of older people and older adults so much more enjoyable even as a young kid, and just pursued my interests further.
Good. And you, Marilyn?
For me, my mother was a musician, and every Sunday after church, almost every Sunday, we went to nursing homes and then just entertained and visited people in nursing homes. So I just grew up that way.
What a great way to get started. In understanding people as they age and being able to reach out now through the Metropolitan Area Agency of Aging, on Aging, to be of help to them. Now, you're a specialist on Medicare, and so I'll begin by asking you, would you tell us more about the whole Metropolitan Area Agency on Aging? Or do you have abbreviation for that, MAAA, or is it?
Yes, but we could just say Metro Area Agency on Aging. It's a little less of a tongueful. But we are really there to be a knowledge resource for people and help people age as well as they can in the community, and find those resources and link them to the resources that he or she may need. And
there are many resources.
There are, and there are many resources, especially if you know where to look and where to find them. There are resources.
But how is the agency affiliated with the Senior Linkage line?
It's a good question. And what it is the Metropolitan Area Agency on Aging offers, in partnership with the Minnesota Board on Aging, a service called the Senior Linkage line. So the Senior Linkage line is really a service that we offer. And what that is we try and help link people and connect people to local home and community-based resources to help them maintain their independence.
Good. And if they need some further help, assisted living, or does your agency help with that too?
Yep, we would help direct people to those resources. We ourselves aren't providing the service. That's a question we get often.
Don't touch your microphone.
Oh, sorry. We ourselves aren't providing that service. Instead, we're trying to link people to those. And do you have anything you would add?
No, but many times just, no, I say no and then I add something.
What were you going to say?
We will just help people figure out questions that they might ask and address, really what are the financial implications of maybe moving to assisted living? What are my options besides that sort of thing?
That's important. A lot of people may not realize that's not covered by their health insurance.
Right.
That's a huge thing, yes.
And so I understand there's a SHIP involved in your organization, State Health Information and Assistance Program? What's that?
That's the Medicare part of things. Every state is required to have a SHIP, a State Health Information and Assistance Program, that is going to work alongside Medicare, helping people make decisions about Medicare, but not benefiting from the decisions they make. So when we help people with Medicare, which is one of the services we provide, we're helping them find the most cost-effective plans for them and tailor it whatever their choices are to what their needs are.
Good. That sounds valuable to have someone who is not directly connected with Medicare but knows it very well and can answer questions objectively. Now, I think we'll see on the screen the phone number, but is that for Medicare 1-800-333-2433?
That's the number for the senior linkage line, 1-800-333-2433. That's the number you'd call about Medicare, you'd call about other services. That's the general number where we've got call centers that answer those questions.
Good. Now, some people, younger people maybe, don't know what Medicare is yet. Is there a convenient way to some people assume you have to be so many years old?
Medicare is actually federal health insurance, and it's for people who are age 65 or people who've been on disability and had a waiting period of over 2 years.
If they've been disabled for more than 2 years, they may get on it earlier than age 65.
That's right, right.
And so it's just mainly to turn 65, you're eligible for Medicare. If you're a citizen, you have to be a citizen, don't you?
No.
Oh, really?
You have to have working credits. Okay, so there are work credits involved, or work quarters. So either you or your spouse has to have 40 work quarters.
So I didn't have to become a citizen to be eligible?
If you are a citizen and you have those 40 work credits, what's going to happen is when you get Medicare, your Part A is going to be free in general.
Oh.
Okay, people who are naturalized legal aliens can buy into Medicare many times, but if they don't have those work credits, they'll be paying for Part A alone, it'll be in excess of $400 a month. So, but it might be the most cost-effective way for them to get their insurance. So they may buy into it.
So that becomes an option then.
It becomes an option.
Yeah. And is it automatic for that people get enrolled?
No, it isn't. Now, when people are already collecting Social Security, if they've started collecting Social Security benefits, they will get automatically enrolled. But for many people, like for me, I was still working when I turned 65, and I wasn't collecting Social Security. So Social Security didn't know me, and you enter Medicare through Social Security. So I had to contact Social Security.
Oh, good. So you were able to do that even though you were continuing to work.
Yes.
And Emily, would you tell us more about the senior linkage line? Are there any age requirement or other requirements for being served?
No, it's a very good question. There is no age requirement to contact the senior linkage line. We help people of any age. Certainly, an age may be dependent on the type of program that the person may be looking for. So for example, if someone were contacting us and said, you know, I just really need help shoveling my sidewalks or raking my yard, I just can't do that anymore. And what we would try and do is link them to a program that could help. And sometimes those programs might have an age requirement, like they might need to be 62 in order to find that program or use that program that helps rake the yard. But in general, we help anybody, and we certainly have caregivers who call us. We have older adults who call us. We have children who are taking care of aging parents that give us a call. And we do help anyone of any age if they need help with paying for their prescription drug costs, so that anybody of any age for that program.
And so, besides the Twin Cities metro area, where else is there a senior linkage line?
Yeah, so the senior linkage line is a statewide service. So it is the state of Minnesota. We have 6 call centers across the state, and we work for the Area Agency on Aging that serves the metro area. But it is a statewide program. So if someone had a family member, friend, a relative who lives up near Bemidji, they can still call the Senior Linkage line, and it's a Minnesota-specific service. You can call the Senior Linkage line and be in a different state as well, as long as you have connections, obviously, to Minnesota.
So talking about Minnesota,
Yeah,
helping
Minnesota.
somebody in Minnesota.
Yep.
And it's not 24 hours a day.
It's not. The Senior Linkage Line service, you can contact them by phone, which is the primary way, at 1-800-333-2433, and it's open Monday through Friday, 8 to 4:30 p.m.
8 to 4:30.
8 to 4:30.
Just like the state offices.
If that's what their timing is, I don't know it off the top of my head.
So, and who provides the services that people learn about when contacting your agency? Your agency is not providing the service, is it?
Correct. We are not. So if someone, again, I give the example of raking the yard. If someone needed help raking their yard, we, as the Senior Linkage Line service, aren't raking the yards. Instead, what we're trying to do is connect people or link people to programs that would do that yard raking. So it would be a local home and community-based program. And one thing is, we never recommend one product or service over another. Instead, we're trying to provide people options to give them the choice to choose what programs they think would fit best for them.
Good. Mm-hmm. So they maintain a choice.
They maintain the choice, yes, absolutely.
And are there Senior Linkage Line programs in other states, or are we just about the only one?
We're fairly unique in Minnesota. I always feel like Minnesota's paving its own way, but the Senior Linkage Line is really unique to Minnesota, and that's a question that we get a lot is, well, my mom lives in Arizona or Florida, or I'm a daughter that lives further away.
Can't you help us in Arizona?
Yeah, right. And there is a national tool finder called eldercare.gov, where you can try and find local resources in the community across the country, but the Senior Linkage Line really is unique to Minnesota.
A much more complete service here.
Maybe. I don't really know all the other services that are available across the country.
And connecting older adults with services seems to be the core of your mission, but keeping them engaged in community life, is that important too?
Absolutely, yep.
I've seen people getting some help in being able to cope with their greater limitations and yet stay in a senior apartment, for example.
Yep.
Yeah.
And that's essentially the idea is, most people want to maintain their independence for as long as possible, and they may not be aware of what supports are available to help them stay independent, and that's what we really try and do is help assess what they may need to continue living as independently and as safely as possible in the community of their choice.
Now, let's see, I've heard of homemaker services, the cleaning up the apartment or whatever, and sometimes a nurse will come in and help somebody.
Personal care attendants.
Personal care attendant. And then ILS, what's that?
Independent living services, and we might refer people to that, but we don't do that. Again, that's one more resource that might be available. Respite, all kinds of things.
Respite care.
That's another
if a caregiver needs time off from caring for a disabled person or a less able person.
That's right.
Right.
Or maybe it's something that's even of more benefit for that care receiver. Many times, for example, older people might be lacking social opportunities, and so they might go to a day program so that they get to have social opportunities and at the same time give that caregiver a break too.
And do you also refer people to Loaves and Fishes, the program that provides hot meals of an evening? I've seen a number of friends go to that.
It may be in the, where we would look, or where the people who receive calls about something like that, questions, they would look in that minnesotahelp.info website, And so we go from the inside out, where people, that's an open website for people to look at, minnesotahelp.info, and then they could search for what's available. And I would imagine it's in there, but we can check to make sure it's in there.
There are a number of churches, I think, that are hosting Loaves and Fishes, which is a secular program. It's not connected with any one religious faith. And the meals are free, and my impression is that there are quite a variety of people who come, not just members of the church, but so maybe that'll be helpful to some more people.
Thank you.
To add that to the information services.
We'll check.
And what is the one thing you want our viewers to take away from this program, Emily?
Well, to me, it's that people know that there's a place to go to find out about resources in the community. So there is somewhere to go to try and find out answers to questions, that you have an aging parent and aren't sure of the services available, or you have questions on Medicare and don't know where to turn for help. But there is a place you can call to try and find out about those resources, and that's the Senior Linkage Line service.
Now, could you give us some illustrations of not revealing confidentiality, but describing some cases where people have needed help that others might assume you're not able to do?
Sure. I'm thinking of do you have a Medicare example?
I can give you an example that I often use. I've helped a woman who lived in a 1940s style home. Okay, and so you can imagine that steep basement, right? And I went there actually to help her with her Medicare, because she had asked for help with Medicare. She had a very limited income, and when I came to the home, I saw that there was some disrepair, and trees kind of growing over, broken window, things like that, and recognized that she needed more help. Also, she had difficulty walking. She needed a walker. So when I went there, yes, I could look at her Medicare needs, and I could find her a program and got her enrolled in something called Extra Help, which means she would pay, actually in her case, she got to pay nothing for a Part D, a drug plan.
Wow,
and
nothing.
Nothing. And she got to have lower co-pays for her drugs because of this plan. Also, though, besides that,
instead of $20, it might be $2 or $3.
Actually, in her situation, she was paying about $80 a month for the medication she was taking, and then she was paying about $35 a month for her drug plan. And with just Extra Help, we were able to get her drug plan for free, so that saved $35 a month, and we were getting her drugs, her medications were costing about $20 from $80, so that's $60. Wow. So right there, we saved almost $100 just by making a simple application for her.
People need to know about that.
Yes.
And to ask you, the Senior Linkage Line, about it.
Right. And we do that direct, that's the one kind of service we do directly. And besides that, then I got her connected with a block nurse program in St. Paul that came in and did some chore services for her. So things, we can do a lot of different things like that.
Yeah, it sounds like that 1940s house needed some repair too.
Right.
Were you able to mobilize something there too?
A little bit.
Good.
And I think the goal in a situation like that many times too is to maybe get a washer dryer on the first floor so she didn't have to go down those steps.
Exactly.
So things like
those
that.
Those dangerous stairs.
Yes.
Right.
Yeah. Preventing those falls.
Right.
Yeah. Well, it sounds like you're a very comprehensive approach to helping elderly people, helping them assess what they need and helping them find what they need. And are there additional, do you have some stories too about the people that have been helped by your programs?
I do a lot of educational presentations out in the public and a lot of outreach at exhibits and events. And I think the thing that is always comes back to me is people may not have known that there was a place to start or to go to find out about supports available. And so that to me is always really beneficial when they say, oh, so I could call the senior linkage line and ask them this Medicare question and I would get help. And I said, yes, absolutely. We try and help, and if we don't know the answer, we try and find out the answer. So that support is available, or I called you and I was able to find out about resources for my mom who lives up in Duluth, Minnesota. You know, it's those are the kind of stories that I hear more so, and a little bit differently than what she has heard.
Yeah.
Something Emily's really good at too, though, is she knows a lot more about elder abuse and how to report that, and services.
That's important.
Yes.
Very important, and it's unfortunately a big problem. But there's a new Minnesota Adult Abuse Reporting Center that if people suspect a person has been financially exploited, abuse, or some kinds of neglect, that there's a number to call. I don't know it off the top of my head, but it's one number now for the whole state of Minnesota.
Well, good. That's a step forward too in improving our civilization. Yeah, and when you speak at various places, community centers, churches, mosques, temples, what do you find people are most interested in?
Oh, and I look to her too because she does presentations. I think always there's a lot of questions around Medicare, mostly because someone, if they're 65, for most people, they may be eligible for Medicare, so it affects many, many, many people. So Medicare questions are quite common, and I think too a growing concern about caregiver supports. What is available to help support the caregiver? Not the person who's receiving care, but the person providing care. Over 90% of all care that is given is by those caregivers, family members, friends, neighbors. So what can we do to help support those people?
And what do you find it really helps the caregivers?
I think the things that I've witnessed, this is just my opinion, sorry I touched my microphone again, is just knowing that there are other people, being able to connect to peers, and also finding those support groups to help talk about their caregiving journeys. But then there's also consultants available who can help facilitate family meetings. There's respite care programs so the person can take a break to take care of themselves, because a lot of times caregivers actually will have their health is deteriorating as well, just due to the stress and demands of caregiving. So once they even know that there are supports available to them, that can be really helpful. And it is National Caregiver Month, right? Family Caregiving Month, so recognize those caregivers. November is that.
Well, this program may be seen through the coming month, and perhaps we should alert them to next November.
Yes, next November. November's an important month that way.
For caregivers.
For caregivers.
To get the kind of help that they need to continue to be a good, happy, healthy caregiver.
Another tool we offer seniors that might be good is that Senior Surf Day program, which is teaching people who haven't used the internet how to use the internet. And we do that in a lot of libraries.
Oh, really?
So it's basic computer knowledge, where people can go to make an appointment and go to a 2-hour class. It's a standard class. It's actually promoted by Medicare, because Medicare wants people to understand how to use the internet, how to surf the internet, how to be able to access the Medicare website so that they can even help prevent Medicare fraud and abuse. So there are a lot of good reasons to do it, but it helps a lot of seniors begin to use the internet too.
I am so happy to know that exists. I can recommend it to a number of people right away.
Senior Surf Day in a lot of the libraries, or they can call the Senior Linkage line and find out where it's offered.
Senior Surf Day. That sounds like we're in Hawaii surfing.
Surfing the net.
Oh, okay. Well, we have only 5 minutes left, and there is so much more to the work that you're accomplishing, you and your associates. How many people are working on this at your metropolitan area aging? It's about 20, 30?
I think we have,
And some are volunteers.
yeah, we have over 80 staff, I believe, and
80?
75 volunteers who are phenomenal. They volunteers that do a lot of the Medicare work and meeting with people in the community. And yeah, we have a great staff of people. They care a lot.
And amazing volunteers
And
that,
amazing
that
volunteers.
augment what the staff can do.
Absolutely.
So not only do we have health insurance counseling offered over the phone at that 1-800 number, but we also have health insurance counseling happening in the communities. So we have these sites where if people call, they can make an appointment, usually with a volunteer then, to meet with them one-on-one to discuss their Medicare situation.
So there might be more than one place in a city like Minneapolis?
Oh, yes,
Oh,
many.
yes. We have over 35 throughout the 7-county metro area. 35 locations, yep.
Good. So there's always one near you where you could make an appointment to with a Medicare expert, a volunteer.
Correct.
And are there other facets that we? I don't think we've said yet how to sign up for that internet service.
Oh, calling the senior linkage line.
Oh, simple as that.
Yep, and make an appointment, find out what library is near you that offers the Senior Surf Day program. And something else that I could point out to people, if they're curious about Medicare, they get a book each year called Medicare and You from CMS, but they also can order this one from the Senior Linkage line. It's called Healthcare Choices, and it's published by the Minnesota Board on Aging. So we're just getting this out now too, and it explains a lot about it explains when to enroll, it explains the different parts of Medicare, and it compares all the plans that are offered in Minnesota for Medicare.
So, you've even got a top 10 list on here. This is published by the
Minnesota Board on Aging, so that's a state.
To enroll, contact Social Security when you turn age 65.
Yes.
What you said, and so on. It goes into Mensure and so on. All the different points of what people should know. But there's a lot more in here about details about different Medicare Advantage plans and Medicare cost plans. A lot of information that we need in order to make a sound decision. Well, thank you for showing us this. How do you get one of these?
Well, I'll give you one.
Oh, thank you.
But actually, you
But
can
how do
call.
other people get them?
They call the Senior Linkage line, and we send it to them. Or they can pick it up in many libraries or senior centers.
Oh, libraries and senior centers will have these.
We're
Hopefully,
just delivering
we're
them.
getting them out right now.
Yeah.
They just
Good.
arrived last week.
Well, you've got the first word on it.
But they're good for the whole year 2016 because there are people turning 65 all the time, and people that have lower incomes may be able to change their plans if it's not working. The plan they have is not working for them.
Well, there, we're back on the picture again.
Good.
I don't know whether you saw this book that I held up a while ago, but Healthcare Choices for Minnesotans on Medicare, the 2016 edition.
That's right.
Available free.
Free.
And you'll even pay the mailing.
We will.
We will.
Wow. Thank you so much.
You're welcome.
I really appreciate your help, Marilyn and Emily.
Thank you.
In learning about the tremendous work that you do for seniors.
Thank you.
Thank you.
We need help, that's for sure. And what you do makes it possible for people to live more happily and probably longer.
I hope so.
Yeah.
Yep. So